Plantar fasciitis is something that if you don't do anything for immediately, it can last months and months, and we're talking even over a year. You'll have limitations in things you didn't normally have limitations in, just general walking, going up and down stairs, some of the basic things we take for granted during the day. In addition, ankle instability is super important to take a hold of early, because with more and more ankle sprains, what you're doing is actually providing the joint laxity, so things are getting overstretched. More specifically, the ligaments. Ligaments are the stability, soft tissue that are in your ankle that connect bone to bone. And when you have multiple ankle sprains, those ligaments begin overstretched, and if they're overstretched, you're not providing that good joint stability that you need, and therefore you will be more prone to continuing to sprain your ankle. And then severe case, obviously, if you continue to sprain your ankle and you keep, doing these things to your ligaments and sometimes even to your tendons, you might actually tear a ligament or a tendon. You can do actually both, and then that will lead to having to have surgery, where then you'll be sidelined for even a longer period of time. Give it the attention it needs immediately, and to stop activity for a certain period of time, depending on how bad it is. So you want to rest your ankle, you want to ice the ankle, you want to compress it, and you want to elevate it, and that will get the swelling down as much as possible. The ice will decrease the inflammation and swelling, but it will also help with the pain. Also, the biggest thing is, like I said, is not doing those activities that you would normally do, such as sports or running or anything, because you need to give things the proper amount of time to heal. Addressing it right away is going to help solve the problem immediately. Yes, you may be sidelined for a short period of time and doing some recreational activities, but in the long run, you're saving yourself a lot of heartache and pain and inability to participate maybe forever in recreational activities later. PT can do a lot to help these things. Plantar fasciitis is something that if you actually don't address immediately, it can last months, and we're talking over a year long's worth of symptoms. So PT, we can assess the pain, we can see what the issue is going on there, where the pain is coming from and stemming from, to make sure that that is really the problem. We can educate you thoroughly about the condition so you're aware of exactly what is going on. The other big thing is assessing your footwear. Even people that normally do wear what they call normal good footwear, like sneakers, tennis shoes, those kinds of things that are supportive, may not be wearing the correct footwear. So we can look at it and make sure it's appropriate for your foot. Stretches and strengthening exercises. For plantar fasciitis, stretching is huge. For ankle sprains, strengthening is super important. Balance exercises, especially with ankle sprains, is super important, because we need to improve the stability of the joint. So we need to be able to get you back on your feet and be able to stand on your feet without your foot collapsing in again. And manual treatment will address any of the soft tissue restrictions, and as well as any kind of issues with joint mobility and the actual joint itself. If you're having pain in your foot or ankle, or you have had a recent injury and you have questions, please feel free to let us know. Just click the link below.